Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. And yourself?
You know me. I'm living it up.
Yay. Well, I always say this, but it's really true for both of us that we do want our listeners to live it up too. And this program is about musculoskeletal pain, which means muscle pain, joint pain, tendon pain, ligament pain, disc pain, back, neck, knee pain, hip pain, arthritis pain, and so much more. And we know that 30 to 40% of Americans are in chronic pain. So you are probably one of them. So give us a call during the hour at 866-870-5752 right here in the studio. And you get to talk to Dr. Darrow directly and see if you can make some headway about your pain or even find out what's going on. And when you phone the program today, you get Dr. Darrow's latest book for free, Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. And Dr. Darrow will talk to you about what that means in a minute or two. But I also want to tell you that we are here Saturdays at 10 a.m., again at 1 p.m., and check out Dr. Darrow's website at www.lastemcells.com. That's www.lastemcells.com. You can email him off of every page on the site and watch him performing the treatments on videos. Very, very educational. And the book has 264 scientific studies. So if you're looking for research, this is the book for you on this topic. And also, our number again, right here in the studio, is 866-870-5752. Give us a call right now. I have lines open for you. And if you've been listening for a while and you want to just call the office and make an appointment or get very personalized information, someone is answering all the time at 800-300-9300. That's 800-300-9300. What do you think?
Excellent. May I go to a question right away?
Sure.
All right. I like to take orders from you. You always know the right way to do it.
Oh.
So this one is about a knee. And by the way, when you go to my website, which is www.lastemcells.com, every single page there has a spot where you can email me. I prefer if you call in, you can talk live to the studio, but you can always go to the website, and I have a slew of questions that come in all day, all night, and I answer them all the time in between patients. When I wake up in the morning, when I get home, after dinner, till about midnight. This one says knee. Let's see what it says here. I'm a skateboarder interested in getting stem cells in my right knee. That's a common malady. Skateboarders have a lot of knee problems, and we have several in our practice. We get all sports. Skateboarding seems like it may not be something that you see a lot of, but it's not like basketball or baseball or golf that many people play in. But there are a lot of people that do it. And the thing is, they get hurt pretty bad. If you've ever watched someone skateboarding, at a high level, they are flying through the air and landing on concrete. We get a lot of ACL ruptures, people that rip the anterior cruciate ligament in the knee. And what I do for those is if they come in urgently, I'll drain out the blood. I've got an ultrasound in the office. Actually, I have 3 of them. And we wheel them around from room to room to look inside of joints. And the knee is very, very particular to where you put a needle. So if you've ever been getting injections in your knees with steroids, cortisone or hyaluronic acid, and the person didn't use a ultrasound, The research shows that the doctor misses the joint about a third of the time. So the solution is going into the soft tissue, and if hyaluronic acid is put in, that can blow up the knee and facilitate the need for a surgery to clean it out, an incision and drainage. So that's something that be very careful about. I don't like to use either steroids or hyaluronic acid because it doesn't do the job. I want to do the job. The job is to regenerate the tissue, grow it back. We stimulate the body to heal itself. It's a natural way of medicine. It's called regenerative medicine. We use platelets and stem cells from the person's own body. Very simple procedure. If you're getting platelets alone, we just take a blood draw, like you go to your doctor and get your labs drawn, same thing, it takes a second. And we then spin it in a centrifuge, and we throw away the red cells, especially for a knee. Red cells are very caustic. They will inflame the synovium, which are the 3 layers of cells around the knee joint, calling the capsule, and they'll blow that knee up like a balloon. So we take the red cells out. Same thing with bone marrow. We get the bone marrow, you lay face down, we inject the back of the pelvis with some lidocaine and numb it up, and then we put a needle in it. It takes about 3 seconds to get the needle in. And then to aspirate out the bone marrow, it takes about anywhere from like 10 seconds or so to get that out. And then we can spin that and then inject that right away also. So this person with knee problem, I don't know what the issue is. He doesn't say if he had an MRI or if a doctor examined it. But the primary things skateboarders get are ACL ruptures. They get medial and lateral collateral ligament tears. Often they get arthritis too, because that knee gets pushed in positions that it doesn't like at all. And we can help all of those issues. I need to actually touch a person's body in the area that needs to be examined and find out where the pain is being generated from. That's the big key in healing a person. I like to look at MRIs and X-rays, but they don't give me the answer of where the pain is being generated from. So a lot of surgeries are done based on an MRI, and that to me is not great medicine. Most patients that come in with failed surgeries, that means they had a surgery and they got worse or it didn't work. When I ask if their surgeon touched the area to find out where the pain was coming from, they say no. They just looked at the MRI, they showed it to me, or the X-ray, they showed it to me, and I saw where the problem was. But that's not necessarily the problem. You can have very advanced arthritis that shows up, let's say, on an X-ray, but you don't have to have pain from that. I know that's a mind bender, but that's what this book is all about, stem cell and platelet therapy. Regenerate, don't operate. There's a lot of studies here that show that it doesn't do any good to just get an imaging. You've got to actually touch the body because the images can lie. I like to get them, but they can be big liars too. And MRIs are overly sensitive. They will show things that aren't really there. Boy, I'm really talking a lot, Nita. I want to give out the phone number so people can talk to me.
All right.
The phone number to the studio is 866-870-5752. I'm going to repeat it so you can write it down. It's 866-870-5752. And to call the office, and there are people by the phones you can talk to for details about all this. The phone number to the office is 800-300-9300. That's 800-300-9300. And I would love to talk to you right now at the studio, 866-870-5752. And sometimes people wait till the end of the show. They're always waiting for that first person to call in. Why don't you be the first person to call in? Because if everybody waits to the end of the show, we don't get a chance to talk to anybody. It's too late. So I'd love to hear from you now. You can throw out any kind of questions about musculoskeletal medicine to me and try to stump me. I like to be stumped.
Fun.
I know.
I like
to stretch my brain out a little bit. And a lot of times callers teach me things, and when they're doing that, they're teaching everybody else, listening to thousands of people who listen to the show. They're also learning from this dialogue that we have.
Absolutely.
Yeah, we have some callers coming in, but not yet. So anyway, the skateboarder, there's a good chance I can heal your knee, and I can't tell you until I see it, obviously, and touch it and know what is going on. So I'm going to take another question here on a shoulder. I inject all over the body with stem cells and platelets. Bottom of the feet, top of the head, neck, back, shoulders, elbows, wrist, fingers, things for arthritis, rotator cuff tears, meniscal tears in the knees, hips, labral tears, knees, all kinds of issues. We get a lot of people that have runner's knee. We get people that plantar fasciitis, the bottom of the foot gets sore from being stretched out. And I'm going to go to Paul right now, who has pain in his feet. Hey, Paul from Huntington Beach, this is Dr. Marc Darrow. How are you today?
Oh, I'm doing pretty good for 96 years old.
Wow.
You only sound like you're 95.
I was going to say 75, but...
Yeah,
no,
you got a pretty young voice, so you're doing great, man. How long have your feet bothered you for?
I'm very optimistic. I never give up.
Good. I'm the same as you. So how long have your feet hurt you for?
Well, I was a runner, and I ran a lot of miles, and that's, it's been, I haven't run in, since, at least 30 years, I guess. But the question is, I have neuropathy. My wife has a neuropathy. She wasn't a runner. My dad had neuropathy. He wasn't a runner, so did the running make that much difference?
Well, I don't think so. Anything's possible. But typically neuropathy is a nerve disorder, and the two major reasons are from alcohol abuse or for diabetes. And, I'm not going to even ask you on the radio whether you were an alcohol drinker. I don't want to embarrass you.
Oh, no alcohol.
Okay,
no,
good.
No.
So most...
I was going to say no coffee, no smoking. I gave up alcoholic beverages at 23 years old. How's that?
Okay, that's good. So let's talk about diabetes. A lot of people that come in to see me are overweight. Almost everybody is overweight who comes to see me. And I put them on a ketogenic diet, the old Paleolithic diet, same thing, protein, vegetables, and water. And cutting out the carbs of grain and dairy and fruit and alcohol and sugar. And when they come in and they have a little tummy on them, I say, it looks like you have diabetes. And they go, no, my labs were checked by my doctor, and I don't have diabetes. And I go, well, then you've got, quote, pre-diabetes. And they go, yeah, I've got pre-diabetes. And to me, pre-diabetes is the same thing as diabetes. It means you're eating too many carbs. And when that happens, the nerves, they gather sugar into them from the bloodstream, and then they expand. Sugar is an osmotic agent. And then from that, the sugar expansion with the fluid will actually kill the nerves. It starts down in the feet and sometimes in the fingers and climbs from there. So I don't know what your weight is, and I don't know what your weight was, but that's a major cause. There are other reasons for neuropathy because so many people in your family had it. It could be a hereditary thing. There are hereditary neuropathies, and most neuropathies are what we call idiopathic. That means doctors don't know why. That doesn't mean there isn't a reason. It's just doctors don't know why, so they call it idiopathic. So I would have to check your feet. There's a blood test we do in our office called SpectraCell, and it checks for vitamins, minerals, amino acids, and all kinds of nutrients that can be low in your blood. And sometimes, being low in B12 or B6 or something like that can cause neuropathies too. So I'd have to check you out. If you can get over to the office, the phone number there is 800-300-9300. I'm across the freeway from UCLA on Wilshire Boulevard in West LA. And I'd love to see you. I'd love to see a guy who's 96 who sounds as great as you do, Paul, because I'm going in the same direction you are, and we're all going in the same direction. And I love to meet people that are very young at heart like you are, who are what we call elderly. I don't know what elderly means anymore, because I have 100-year-old people that come in that seem like they're 25 years old. But again, on the opposite, I have people who are 25 that seem like they're 150. So I don't know what age means anymore. We're in a new era, and things are changing. And I just want to say God bless you, Paul, for calling in, and I hope to see you someday. Thank you.
Thanks for your call.
Okay. Well, it'll be a little while. I'm in a retirement home right now, but it's not working out, so I'm going to go home again. I thought I was going to get better. I'm getting pretty good service, but the noise is terrible. Okay.
Yeah.
Well, I'll get back to you on the call.
All right. Thank you so much. Yeah. I appreciate your call. Thank you.
Our number is 866-870-5752 right here in the studio. Give us a call. You can speak with Dr. Darrow. I have lines open for you. Check out the website at www.lastemcells.com. That's www.lastemcells.com. And
may I?
I just was going to mention the free book that you give out.
Yeah, the book is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. I'm showing it to the camera right now. And there's a foreword by Suzanne Summers, who's one of my best buddies. And she and her family I have worked on for many, many years using platelets and stem cells, and we've had very good luck with them. And she actually wrote a book which is called A New Way to Age, and it's one of the books she wrote that has a chapter on me. And this one, which is her most recent, is an interview with me on page 302. I'm showing this to the camera. And it's about a 19-page chapter, I think it is, on all about regenerative medicine and stem cells and platelet therapy and how that can help you. Also in the office, we do the same procedure that I do on the musculoskeletal system on the face. We can do vampire facelifts with platelets and or stem cells and regrow the collagen in the face and make a person look younger, feel younger. It's a very quick procedure. It's painless. And we can also stimulate hair on the top of the head using these procedures, stimulate hair to grow back. So we have a lot of cool things in the office. I'm checking to see. We do have a caller here.
Yeah, how about
doesn't
let's go
have
to
the
Rach.
name.
Actually, I saw the name. It's Rachel. So
Rachel, are you there?
Let's see if we can pick her up. I can't pick her up yet. Okay. Well, maybe.
Did you see what the question? Oh, here it is.
There it
is.
is.
Shoulder, hip, right knee, and foot. Oh boy. Rachel, how are you today? Dr. Marc Darrow.
Oh, I'm great. Well, I could be better. I have been trying for a month to get to you. I was in a. Can I talk to you now? Is it okay?
Yeah, we're loving you. Go ahead.
I was in a car accident, and in the process a year ago, and I thought it was going to get better. It got worse. Due to COVID, I did not have any operations. Thank the Lord, I heard about you. I've had two friends that had some tremendous success with what you have done, and so I don't know if it's even worth, but I want to try. Number one, the car accident, my car was completely off, and I was in a car that was stopped. I was rear-ended, and in the process, my right leg, my right hip, they said I have a small crack. Forgive me, I don't know the technical term. The right knee, apparently there's a torn meniscus. And recently, after a year and a half later, now my right foot the toes are paralyzing the middle toe.
Okay.
And I don't know if you could, would the knee would be something you could do. I don't know exactly where to begin, but the foot, the knee, everything on the right side is kind of out of whack.
I'm so sorry to hear that. I hope you're feeling better from your car accident. It's terrible.
Yeah, I was lucky to.
It sounds like, from what you said, your hip has what we call a labral tear.
I
and the labrum
so, yes,
is, yeah, the labrum is a Latin word, lip. It means, and what it means is there's some fibrocartilage that surrounds the femur to hold it in to the acetabulum, which is the hip joint.
Yes.
And there's often tears in that surface, but they don't often cause pain, and surgeries for them usually fail, so be careful about that. We usually heal them up and the pain in the hip by using platelets and or stem cells from your body. So that's something to consider. I have to examine you first, and I would look with the ultrasound to see what that labral tear looks like. The nice thing about the ultrasound, it's live. I have them in all the rooms, so I can just take a look immediately when you come in the office, and I can look at your knee also and see what's going on, see if you have fluid in there. The foot with the numbness in the toe, I'm not sure about. We have to touch that also and examine you. But there is good hope from what you're telling me. Are you able to walk around now?
Oh, yeah. It's been a year. It happened a year ago, December, but I didn't want to do anything because of COVID, because of the fear of surgery and infection.
Okay, yeah.
I've had both.
Well,
my
thank
shots.
God. I mean, well, that's great. COVID has saved so many people from having needless surgeries. And I have to always say this as a caveat with the show. I love surgeons, and to be honest, I love surgery. I have to be honest with you. I used to do it when I was in my training, and I got as many rotations as I could in orthopedic surgery because that was my path, and I just loved it. It's really a fun thing. It's a real male sports kind of an activity as a doctor. And the problem is I don't like the outcomes of the surgeries, so I switched horses midstream, and I got out of surgery and I went into what's called physical medicine rehabilitation, where we actually rejuvenate the body. So regenerative medicine is what I do instead of cutting tissue out. Now, all that being said, I love the surgeons. I never say a bad word about surgeons. I just say bad words about the surgeries, because way too many surgeries are being done that should not be done. People come out worse. I'd say the batting average that I've seen is about 50%. That's not worth it. And people come out of people come out of surgery worse than they came in very often. And again, this is not a statement against the surgeons. It's what they grew up in. When I was growing up in the surgical culture, I thought surgery was the only thing that can heal. There is a need for surgery. If you break a bone, go get to the surgeon. If you have things like that, if you have a cancer, get to the surgeon. But for most of these musculoskeletal disorders, meniscal tears, ACL ruptures, shoulder issues with rotator cuff tears, labral tears, I personally don't think surgery is the proper option. And I'm sorry I feel that way. I'm sorry if surgeons are listening. It's not against you guys. I think you have a great thing that you do for people, but I don't think these type of surgeries should be done. I see terrible results. Sometimes people get them done and they feel better, and then a year or two later, or 3 or 4, they're worse off than they were before because there's less tissue to support the joint or other area. So, Rachel, I think there's good hope for you healing up. But I do need to see you. If you want the phone number to the office, it's 800-300-9300. I'm going to repeat it for you folks while you write it down. It's 800-300-9300. And I'd like to get on to Thomas now, Rachel. So God bless you. Thank you so much for calling. And need anything to say before we take Thomas?
Yes, I just want to give the phone number out because I have lines open for you at 866-870-5752. Right here in the studio, speak directly with Dr. Darrow. And we have Thomas in Redlands.
Thomas, I understand you have feet.
I have two. Lucky.
That's a good start.
Well, why don't you FedEx them over and I'll take a look at them.
That's a good idea. Probably happen in a few years. You never know.
So tell us your story. What's going on for you, Thomas?
Well, I'm pretty sure it's neuropathy. I'm a veteran, and I was at the Veterans Hospital going through some tests in Phoenix about a year and a half ago. And they did a lot of nerve testing, and basically the doctor didn't want to get into a lot of description other than say you have some nerve problems in your feet. Your doctor in Surprise, Arizona can talk to you about it. So going back there, and I was in really good condition. I didn't feel any threat from falling over, things like that. But I think progressively it's gotten worse. And my stability isn't there like it used to be, and that bothers me, obviously. Probably maybe a month ago, I was...
Thomas, would you please hang with us? We're going to go to a break.
Yeah, stay with us, Thomas.
Yeah, stay with us. Don't give up. For those of you that want to call us, the phone number to the studio is 870-5752. I want to talk to you.
You're listening to Living Pain-Free with Dr. Marc Darrow. We'll be right back after these messages.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.